So if you have back pain, if your back pain is worse with one range of movement or maybe two max, and or with one activity, like it hurts when I play basketball, it hurts when I bend to the right, it hurts only when I ballet dance. I don't know, I don't ballet dance, but you know, we've been doing this for 20 years. We've heard a lot of different things, and we treat ballerinas also. Point is, it hurts with one or two things, not all the time, and not constant.
Right.
We categorize this as mechanical. The most important thing we teach our patients here who have this mechanical pain is how to give their tissues what we call a micro break, because that's really from overdoing something.
Right.
You have a habit and you keep doing it, and it's irritating the muscles, the ligaments, the fascia. So the first thing we're going to teach you now, something you do today, is a micro break. What's a good micro break for low back pain patients?
So you're going to stand with your feet about hip width apart, and you're going to reach both arms to the sky, and then you're going to reach more with the right, more with the left, more with the right, more with the left, more with the right, more with the left. Bring your hands down, lift your chest, draw your chin back, and then you're going to spread your fingers nice and wide, turn them out as far as you can without any pain, and then you're going to breathe into your belly. And you can actually keep doing this while we talk about more of the program.
Yeah, and honestly, this is our version of the opposite of this, which is slouching is one of the common reasons of back pain or any kind of activity. And what Courtney showed you is literally includes all of those elements that are going to get you out of that repetitive micro trauma that you put on your back or that static trauma you put on your back.
Right.
And a little breathing can't hurt either because you get oxygen to the tissues.
That's right.
The whole thing takes like a minute, okay? A minute of this every 30 minutes to 45 to an hour in your day is going to make a huge difference on your path to healing.
Yes.
Okay? It's just a little something from our program. There's other somethings in our program.
There are.
If they're interested. If they feel better after doing this for a few days, but they want to go deeper and then actually make themselves even more bulletproof, what do we have?
So in our program, we have certain curated supplements that can help the tissue heal faster. But then we also go through what we call fundamentals, which are those things that we do every day, like
how to sit, how to sleep, how to get in out of the chair. And that just prevents that repetitive micro trauma, which is the cause of mechanical back pain. And we also have this really cool thing. What muscles do they release first?
Right.
What muscles?
Then we go in a specific order where you release certain muscles that are overactive, because we all like to turn into gargoyles in the modern world. And then only after you release do we strengthen the muscles that are underworked.
And that sequence is what we've developed over the last 20 years. That really what differentiates us from the other programs out there, which haven't worked for you, obviously, because otherwise you wouldn't be watching this video. So please check us out, mykinetics365.com. So if you like this video and you found it useful, we actually have a specific sequence program that we've developed over 20 years that includes what, Courtney?
So we do start with the fundamentals, how to do no harm, and then we go into a very specific release program. And then after you have learned to release the muscles that are overworking, how to strengthen the muscles that are not working enough. And typically we get people out of pain in 4 to 6 weeks.
Yeah, and there's also like curated supplements. I mean, it's very unique and it's very specific and very sequenced, and it will actually cost you less than 14 minutes a day.
Yes.
So check us out, mykinetics365.com.